how big a problem for the U.S. healthcare system are diabetic foot ulcers?
Diabetic foot ulcers are a huge issue with the U.S. healthcare system. 10% of the population, or 34.2 million adults, are diabetics. Currently, there's $11 billion being spent on wound salvage and amputations. And then there's $200 billion collectively being used on diabetics as far as their care in hospitals, nursing homes, and in doctors' offices. A consistent stat is that 20% of all the admissions to the hospitals over the years have been from diabetics having issues, complications. And then 85% of all the lower extremity amputations are from DFUs. Yeah, it's a huge problem that's bleeding the system.
There's about 900,000 to 1.9 million, depending on the numbers that you look at, ulcerated patients every year that have to be taken care of. Not only is it a big need, it's a big drain on the system because it costs billions of dollars every year to manage these patients, and anything that can reduce that cost is, especially in the areas of offloading, the costs are so minimal to the system and the gains are so great.
What's a typical cost of an amputation?
I've had people go into the hospital for simpler things than an amputation and have the overall bill be in the $200,000 range. Given the cost of an average amputation, which is incredibly high, the cost of interventions to prevent the amputation is minimal. I mean, even a full-scale onslaught with total contact casting for 8 or 10 weeks, followed by an offloading device with a top-notch insole like FORS, it wouldn't come close to the cost of a single amputation, which is why I don't understand why there's any hassle whatsoever about paying for offloading devices for patients. It's not helping patients at all to restrict their access to appropriate footwear and appropriate insoles to offload these wounds.